The title of my talk is called Thinking About Medicine Outside the Status Quo. And the title was inspired by Jeffrey Tucker's book, who's the editor of the Mises Institute. He wrote a book called Bourbon for Breakfast, Living Outside the Status Quo. So I can't really take full credit for the title. But I thought, I didn't really know what I was supposed to talk about today, and I didn't even know there was an official title for my talk, which apparently there is. So I just thought I would make a title that was kind of provocative, and I thought I would do something a little different with this talk, which was, I don't feel like I'm going to teach anybody here anything, except maybe the medical students. You're all older than me, you're probably wiser than me. So I thought what I would do was give a talk that I would try to give to medical students or residents or college students about this issue, and maybe get some of your feedback after the presentation. I'm sure you're going to want to go to lunch and not ask questions, and that's fine. And just see what you think. And it's unfortunate because when I think of giving talks to medical students, I always think of when I was a medical student, and the one thing that would get me to go to a lunchtime talk was free food. And I would, so kind of you need to have food at the talk. And, we're pushing lunchtime right now, but there's no free food. So I hope you do bear with me. And, if I was going to give this talk to medical students, the first thing I would talk about is the idea of breaking the carapace of nobility, which is getting to the idea of, is healthcare a right? And we've already touched on it here, but all the information about medical economics, I think, is relatively unimportant in the grand scheme of things, because it's always going to come back down to the question of, is healthcare a right? Because even if we had a free market and medical care was much cheaper, which it would be, there would still be somebody who didn't buy insurance or who couldn't afford something that they needed, and they'd get the question that was asked a couple debates ago about the guy who didn't have insurance and got in a car crash and was in a coma for like 2 years, And so we have to be able to articulate a good answer to this question. And, we can't just say it's not a right because it's not in the Constitution. And that's not going to satisfy most people. We can't say it's not a right because our founders didn't say it was a right. We have to really be able to articulate what the danger is of declaring that healthcare is a right in a way that people who aren't political philosophers, who haven't studied this, can understand, and then to tell other people as well. So I'm going to talk about what are natural rights and why, as political ideas, were they revolutionary, and then the real implications of a right to health care. So, and remember, I'm not saying this because I think you're going to learn something new. Put yourself in the place of somebody who isn't already familiar with these things. So, natural rights are negative. They define what somebody, including the government, cannot do to you. They do not oblige anyone to act on your behalf, and vice versa. They include life, liberty, and property. Now, people might already be a little confused because property wasn't in the Declaration of Independence. It was pursuit of happiness. Jefferson wrote property, but it got scrubbed because at that time, our founders were already uncomfortable with the idea of slavery, and they did not think it was right to put the word property in the Declaration of Independence and thus forever legitimize slavery. So, but property, in terms of property gained through an individual's own actions, is indeed included in natural rights. So we have life, liberty, and property. What's the historical significance of this? It's hard to appreciate this living in the world we live in now, where even the poor have a quality of life that is so much better than what we can think of for the average person living in the 1700s or the 1600s or the 1500s, but it's important to know the historical significance. And, liberty, as it's defined in the classical natural rights tradition, is freedom from all arbitrary coercion as it applies to social relations. It's not freedom from internal factors such as guilt or, lack of education. It's freedom as it applies to social relations. A rock climber who falls into a crevice only has one way out. We wouldn't say he's unfree, however. Freedom applies to social relations. That's how it was meant by Locke, by the founders, by those who were instrumental in developing these theories. This notion is radical because for most of human history, the average person's life could be characterized as one of servitude to the arbitrary whims of the ruling class. Government in the old order was marked by physical force and a mystical belief in its power. Ayn Rand wrote in her book, For the New Intellectual, that for most of human history, government could be characterized by witch doctors and Attilas. And what she meant by that was people who claimed a divine right to rule. Those would be the witch doctors in Rand's view. Rand was a little harsh, but I think right on a lot of things. And the Attilas were the people that just ruled by conquest. They'd crack your skull, beat your head in if you didn't follow them. And I don't think that this view is incorrect. I think it was Gordon S. Wood who wrote in The Radicalism of the American Revolution, the dominant 17th century image of society, which was the one that America was revolting against, was called the Great Chain of Being, a hierarchy of ranks linking the monarch with the lowliest peasant, with each fulfilling its duties by commanding its inferiors and obeying its superiors. So that was kind of the state of life for the average person prior to this declaration of natural rights in the American Revolution. So what does that mean? Well, so I hope we can appreciate kind of the radical context of that, putting ourselves, keeping that in mind. So what does that mean for medical liberty? And medical liberty is no special thing. If we just know what liberty means, if we apply it to the practice of medicine, medical providers can allocate their services as they see fit. Patients can freely contract with medical providers for services. And companies can offer insurance products to individuals to cover medical services and charge whatever price they deem to be appropriate, so long as they don't use force or fraud. It's pretty simple. Now I need to skip ahead a little bit so we can understand how we're in our current state. So I have to talk about the progressive movement. The progressive movement arose in response to perceived social inequities brought about by the Industrial Revolution. Progressives rejected the classical liberal belief that man should be free from all arbitrary coercion, and instead favored government coercion as a means to bring about their idea of social justice. Now, this is, when we look back on it now, it's surprising because, yes, social inequities certainly existed as a result of the revolution and widened during the Industrial Revolution. But ironically, even as the gap between the wealthy and the middle class and the poor may have been widening, the quality of life and standard of living of the poor and the middle class was going up dramatically. This is not disputable. That's the fact. But they recognized, I think, a chance to grab power, if you will. Instead of appreciating that quality of life and standard of living were improving for everybody, they couldn't come to terms with the fact that there were some people who were still doing much better than others. So we come to the notion of social justice, which is a very arbitrary notion. And I think John Rawls dedicated his life to kind of elucidating the idea of social justice as fairness, as opposed to justice as equality under the law, as it was in the kind of natural rights tradition. And Rawls said something like, social justice is the conditions that each of us would adapt if we thought impartially, rationally, and I don't know, about our conditions as human beings. Completely arbitrary, and the implication was that if you didn't agree with Rawls on social justice, it was because you didn't think impartially and you didn't think rationally. How do you dispute that? Well, Hayek disputed it. Friedrich Hayek disputed it nicely. He said there's no objective criteria to determine under conditions of social justice what individuals or groups of people would actually achieve. He said social justice doesn't belong to the category of error, but to that of nonsense, like the term a moral stone, were Hayek's words. And the progressives have never effectively countered this. They just simply say, if you disagree with us, it's because you're stupid. I'm serious, I really believe that. It goes back to that Rawls definition, who think rationally, fairly, impartially about our condition as human beings. If you don't agree with me, you're not rational, you're not impartial. There you go. So then we get to the notion of positive and really counterfeit rights. And President Obama, but I think when he was a state senator, said in a radio interview in 2001, the Constitution is a charter of negative liberties, says what the states can't do to you, says what the federal government can't do to you, but it doesn't say what the federal government or the state government must do on your behalf. I mean, you got to scratch your head. Like, do you think the founders forgot that part? How many federal papers or how many chapters are in the Federalist Papers? They didn't forget it. The progressives aren't carrying on the traditions of the founders. They're not carrying on the traditions of the great natural rights thinkers. They're not carrying on the traditions of Locke. They're radically opposed. They're carrying on the traditions of feudalism, right? So the omission of positive rights was quite intentional, because the positive rights progressives speak of are in direct conflict with the negative rights embodied in the natural law tradition. If two rights oppose one another, one of those rights is illegitimate. It's a counterfeit right. Counterfeit rights have consequences as ugly as they are undeniable, and I'll get to that next. So, it brings me to this idea of the right to health care. How do we explain to people that this is just not a good idea? It's a counterfeit right. You're not helping people by declaring there's a right to health care. Just ask somebody the next time they say health care is a right and look at you like you're a monster if you say you disagree. They ask them, what does the right to health care actually entail? Nobody can define that. They don't know. So have you ever heard anybody define it? I've never actually heard anybody define it. Does it mean, and I think this is what the average person thinks it means, does it mean that anybody can have whatever they need in regard to their health? Certainly it doesn't mean that. I think what it means, and what I know that it means, is that you're obliged to pay into a system where the government decides how medical care and medical resources are allocated in an impersonal manner. That's what the right to health care means. That sounds, to me, a little bit scary. I'd rather have the rights to life, liberty, and property, and you can take your right to health care. That's how we need to be explaining this to people who disagree with us. And I watched I saw Dr. X Senate hearing, I heard Rand Paul give his response, which was quite impromptu, and it was excellent. And we all need to be able to do that. So when somebody challenges us, we don't have a deer in the headlights look and can't give an answer to that question. And if we can't answer that question and articulate it well, we will lose this debate. Healthcare, we have to be firmly in the corner that healthcare is not a right. If we're not, we lose. So the million-dollar question then, and what you're going to be asked, is, like they were asked on the debate a couple weeks ago, what do you do for the poor or for the person that can't afford some healthcare service that they need? My answer is always the same, and it's an answer that Rand gave. She said, well, I'm not going to stop you from helping them, and I hope that you're not going to stop me from helping them. And if anybody has a problem with that answer, I think they're the ones that really have the issue, because we're talking about voluntary, spontaneous action. We're talking about taking responsibility for problems that we see arise. And I think that's much more valuable than the alternative. We're not saying, I want that person to die in the street. No, what we're saying is we want to decide how we help them. And we're going to take responsibility for it ourselves. The opposite to that is somebody can say, well, if it's, I say it's my responsibility, I'll decide. But if the answer is society, then it might as well be nobody. Has anybody heard the anecdote, what happens to a horse when two people are assigned to feed it? It dies. Yeah, it starves. I mean, that is exactly what happens with collective responsibility. Collective responsibility means nobody's responsibility. And then we can see what I'm going to use that. I will always give you credit for it. But that's a brilliant table there showing the difference in cost to treat somebody in a real charity clinic versus a government-run health center. I mean, I think that kind of, end of debate. If you show that, you can't lose. But we have to be very firm in articulating that. So healthcare is not a right. And now I'll get a little bit more into the economics, which is, I think, what Dr. Eck probably wanted me to come here to talk about anyway. So it's not a right, if we agree on that, but are there benefits to government intervention in the medical marketplace? So I'm going to talk about the Austrian perspective on central planning, because the Mises Institute is all about education in Austrian economics. Austrians believe that, and probably a lot of mainstream conservatives believe this as well, but Austrians are a little more ideologic in this. Government planning always and inevitably fails. It can't not fail for these reasons. Government intervention distorts price signals through subsidies and regulations, making future calculations of value, cost projection, and savings impossible. And this makes sense because when you think about it, if government wants to provide a subsidy for some part of cardiology care, they may say, we're going to subsidize echocardiograms because we think people that make less than $100,000 a year pay too much for echocardiograms. Right now, the price for an echocardiogram is $200. And based on the fact that so many echocardiograms are ordered a year, this is what the cost of this program is going to be when we pay 1/4 the cost for an echocardiogram. So they use static modeling and static, cost projections to try to determine what programs are going to cost in the future, and that's why they're never right. And that's why they never have enough money for the programs that they say they're going to have enough money for, because it's actually impossible to calculate what the costs are going to be when government intervenes. So what happens is they provide subsidies for echocardiograms, and now instead of 1 million echocardiograms being ordered, because there's a subsidy, 5 million get ordered. The program is 5 times more costly than they predicted, and also the price of echocardiograms shoots up to twice what it was because the demand for echocardiograms has gone up. That's, and I'll show you that has been what's happened with government intervention in medicine. Number 2, central planners lack operative knowledge and are thus unable to account for the actions of millions of individuals living in different situations and responding to different incentives. And this idea of operative knowledge is very important to Austrians. And what that means is that, only the people that are on the ground providing the service, they're the only ones that really know what the true needs are and what the true resources are that are available. And that's why the entrepreneur is the most important person in all of Austrian economics. Anything that supersedes the individual entrepreneur's judgment will fail, because anybody outside the level of that person on the ground with the operative knowledge cannot possibly have the information available right then and there to make any type of coordinated actions or decisions or cost estimates or projections like the entrepreneur himself could. Therefore, government planning will fail. Number three, there's a pretense of knowledge that systematizes risk and bad practices when government gets involved in anything. And, this pretense of knowledge is, it drives me nuts. So the cardiology fellows had to meet the other day with one of the physicians who was head of quality control for a hospital, and he was talking about external process measures that were going to be placed on doctors that needed to be met for the hospital to be fully reimbursed by Medicare. Well, this is pay for performance, just different words for it. And one of the quality measures is that patients with high blood pressure in the outpatient setting need to have their blood pressure controlled to less than 130/80, or you're not going to get paid. Well, that's a little bit of an exaggeration. 50% of your hypertensives need to have their blood pressure controlled to 130/80, or you won't get paid. So I said to the guy, hypertension happens to be a topic of importance to me. I've been doing research in it since residency. I said, I don't agree with the guidelines. I said 130/80 is not based on evidence. In fact, it's refuted by the newest evidence that suggests that going for 130/80 doesn't improve outcomes, but it increases the risk of a serious adverse event by 3 times. That's from the Accord trial. So now I'm not going to go for 130/80 in my patients. That's wrong. I'm not going to subject them to that harm without any benefit. I don't get that choice. If they don't go to 130/80, I don't get paid. Essentially, that's what it comes down to. So this is pretense of knowledge at the level of bureaucrats. They think they know what's better, and you know what? It's possible that 130/80 is a better number. I'll leave that open to people's opinion, and I'm happy to have a debate on the science and the evidence that surrounds it, and I'm perfectly fine if I disagree with somebody, if we're respectful to each other, and you're not going to beat me over the head for not doing it. But essentially, that's what's going to happen. We can't disagree. There's no disagreements in judgments now. There's one way to do it, and that's the only right way. I don't even know why you go to medical school. You could get monkeys to do this. Everybody in your office, 130/80, keep feeding them pills till they get down to that level, and then you get paid. You don't need medical education for that. The last part of this, and I don't even think I need to explain it, is that planners are too willing to sacrifice honesty and prudence for expedience and power. I don't really think we need any more examples of that. So I think I can easily prove that government planning fails with a series of slides. So this slide is, this figure is voluntary enrollment in private insurance plans prior to 1960 in millions. Most insurance plans at that time were catastrophic coverage plans. They didn't pay for routine doctor's visits. They were real insurance. They insured against risk, not routine things, not uninsurable events. And they were growing in the private market, and they weren't perfect, but they were working themselves out, and it was okay. 75% of the American population had private insurance before 1960. Insurance wasn't even really invented until like the 1920s or 30s. In the market itself, we have 75% enrollment within a 30, 40-year period. That's pretty impressive. At that time, American medicine was considered the envy of the world. This chart right here is original. I'm kind of proud of this. I made this. This is medical care price inflation versus the Consumer Price Index for 1947 to 2007. This chart could actually look much more dramatic if there was official data on medical care price inflation past 1947, but there's not. So I can only go back to 1947, or else everything prior to 1970 would look really flat. So what happened is when the government got involved, Medicare and Medicaid, medical care price inflation shot through the roof. You want to know why medicine's unaffordable? It's because the government's involved. If this chart doesn't convince you of that, well, you know, I'm probably not going to convince you. But I think it will convince most people who, as Rawls would say, would think impartially and rationally. This chart shows why medical care price inflation soared. Well, look what happened in 1965. Out-of-pocket spending declined dramatically, and federal, state, and local government spending increased dramatically. You just flip back and forth between those two, and you just keep showing them until the person believes you. I mean, seriously. You know, what has the Medicare effect been? You know, I'm going to get the name wrong. Dr. Burdine, who also happens to write for the Mises Institute, I think he's involved with Texas Tech Medical School. He wrote, Medicare is responsible for the completely distorted view of health insurance shared by most Americans. It is a scheme to socialize the cost of uninsurable events in the elderly through Ponzi finance that is totally insolvent and unsustainable. That is true. You know, it's considered the third rail of politics, but why? I mean, I think we've been deluded to a large extent into believing that Medicare has done amazing things for the elderly and for our entire population, but it hasn't. This is a chart showing life expectancy from birth, age 20, age 40, and age 60 since 1900 to 2000, and as you'll see, the trend lines have not dramatically changed with the introduction of Medicare and Medicaid. I mean, you know, the progress that we've made has been a result of increasing standards of living that are the result of capitalism. I mean, that's the truth. Sorry. It's not Medicare or Medicaid. Clearly, if it was, we'd see a dramatic difference in the trend line when Medicare was introduced. So Medicare's legacy. It's increased spending on Medicare without improving mortality for the elderly. That's a fact. Has projected the notion that personal spending on health insurance, taxes plus premiums, should be less than annual benefits received. It is actually a less than 1 to 10 ratio. And it's bastardized the notion of what insurance actually is, thus promoting medical care price inflation and leaving us in our current position. More Medicare economics. A Medicare beneficiary would have to earn over $358,000 a year on average over the course of their working life to pay the payroll tax to cover their average Part A benefit of $5,205. You know, this is from actuarial tables. If you project what the average person gets over the course of a lifetime on Part A and what they would have to pay over the average course of a lifetime as a worker, well, there's not that many people making $350,000 a year, so therefore it's impossible to finance that. And less than 1/3 of Medicare Part B is paid through current premiums, so it's impossible to finance it if you're not paying enough for it to begin with. And the rest of B and D are paid for through general revenues, while the Treasury is currently running $1 trillion plus deficits. I mean, it's frankly impossible to fix. Talking about fixing it is, you know, I think it's like trying to get blood from a stone. It can't be fixed because it was a Ponzi scheme to begin with. And all the things we talked about why central planning inevitably fail, are highlighted by Medicare. Estimates of the size of Medicare's unfunded liability range from 50 trillion to over 100 trillion. 50 trillion is the low projection from the Medicare trustees, which, I mean, what difference does it make? 50 trillion or 100 trillion? I don't think it makes much difference. And only in government, and this is getting back to the idea of why government inevitably fails. In 1965, the government estimated that in 1990, Medicare expenses would total $12 billion. Remember, static revenue modeling. Instead, actual spending turned out to be $110 billion, so they were off by a few percent. It now exceeds $500 billion, and what will actually, so take that and now try to figure out what we're actually going to spend on the new healthcare law. And so I guess I want to just conclude with some of my own ideas about fighting back effectively. So the first thing is you have to stand up to what I call the cult of authority. And this gets to this idea of the institutional experts. And it's something that Friedrich Hayek and Austrians talk about a lot, which is institutions become so complex that you need a postgraduate degree to figure out how to navigate them, right? And if you don't have that degree, your opinions are never actually taken seriously when it comes to discussing those things. So, nowadays, if you don't have an MPH or a master's in public policy or health economics, nobody's going to listen to you when you tell them anything about Medicare. I mean, unless you're just obnoxious about it like me and the Mises Institute and places like that, nobody's going to listen. So that's one. I mean, the people that do this, these institutional experts, have a very vested interest in maintaining the credibility of the institutions. Somebody with an MPH, if Medicare fails or Medicaid goes under, they're not needed that much, to be quite honest with you, not to offend anybody who has an MPH. But if we just had a free market that came down to a doctor contracting with a patient and insurance companies offering whatever policies they wanted at actuarial fair premiums, there's not much need for somebody with a master's in public health or a master's in health policy. So these people are going to fight tooth and nail to make you seem like a complete idiot anytime you talk about these things, and you just need to be confident and stand up to them every chance you get. And for me, since I'm still in a hospital system as a fellow, I get a lot of chances. I think the second part is very important, and that's to try to avoid partisanship. So now that I'm with the Mises Institute, I'm kind of considered like a radical libertarian. The left doesn't like me that much. Some of my old friends on the right don't like me that much, which is fine. That's fine. Because I think if we make it only about right-left, we turn people off before we even make our points. I mean, it's really, there's enough blame to go around for the right and the left in terms of destroying liberty in the practice of medicine. So I think you have to, when you're talking to people, it's not right-left. I'm about liberty, and I always make this clear. I'm for liberty as opposed to coercion. I'm for bottom-up solutions as opposed to top-down fixes. And that makes a difference to people. And people that might not have listened to you if you were very partisan, I find they do listen to you, and that makes a big difference. And then finally, just present the facts. And sometimes figures are very helpful. So like I said, I have this downloaded on my phone, so sometimes I just flip back and forth like that when I'm debating somebody. But it makes it very difficult if you have the facts at your disposal and not just some falutin ideas about, well, government stinks and the market is the best instrument. It is, but you have to be able to support that in a convincing manner. And that's my talk. Thank you.